Now I'd like to hand it over to our speaker today, Stephen Sital. Welcome.
Hi, everybody. Welcome back. If you are new to the whole cannabis stuff and have not been watching my other lectures today, my name is Stephen Sital, and I'm an RVT out of California. I am also heavily interested in this particular topic and cannabis in general, and have published a couple of papers on it. Dr. Mosley and Dr. Sarah Silcox, who you watched earlier, are also part of a fantastic book that we have coming out with the next couple of months. It was supposed to come out this month, but we had some delays, so it'll be out in June or July. And it's on all things related to cannabis in veterinary medicine. So very excited about that. Currently, I am at Stanford University and I work in the Department of Neurobiology and doing some more studies. So let's get started. And I wrote this lecture because I think we're at kind of a point in this discussion of cannabinoids in general, where we're kind of stuck in a trench, and I think people are getting the idea of what CBD is versus what THC is, but we're kind of missing the rest of the things that are in a lot of these products. I know Canada does have some special considerations. I know there are a lot of isolate products in Canada. We'll talk about what those are. But as we progress in this particular movement of cannabis for animals, I think it's really, really important for us to understand the other things that are in a lot of these different products and how they can affect the efficacy of these products in our particular patients. So let's get started. All right, so obviously, I think we're very familiar with the term, at least CBD or cannabidiol, and THC, tetrahydrocannabidiol, which is the more intoxicating molecule that we get from the cannabis plant. Obviously, we have quite a number of studies looking at the utility of these particular compounds in several different disease areas, particularly with CBD and THC, but we also have a number of other phytocannabinoids or things that are similar to CBD and THC. So there's well over 100, with several being discovered all the time. I think in the last couple of months, we've had 3 new forms of THC that have been discovered that are significantly more potent than regular Delta-9 THC that we encounter. And as we get special breeding of these different plants, we get different varieties, different chemovores, cultivars out there, we are going to see a new influx of new cannabinoids that maybe we're less familiar with, or different and higher concentrations of what are considered minor cannabinoids compared to the products that we have on the market today. So meaning that a product might not be a CBD dominant product, but maybe a CBG dominant product, or a CBC or a THC dominant product. So we should start to get familiar with some of these things. Unfortunately, though, the data, comparatively speaking to what we have for CBD and THC, is really lacking for some of these minor cannabinoids, and certainly terpenoids, which we're also going to be talking about today. First, I wanted to discuss this little section about the endocannabinoid system, a little bit overview, probably stuff that you heard Dr. Mosley and Dr. Silcox discuss already today, but I think it's important to just review and really solidify in your mind and your memory. So when we're talking about the endocannabinoid system, we have developed with this endocannabinoid system throughout the eons. We still have some fairly primitive species alive on the planet today with very rudimentary endocannabinoid systems. In fact, they're receptors that are normally binding with endocannabinoids, the things that your body produces, or with phytocannabinoids, the things that the plants produce. They have what are called orthologs, or receptors that are like the primitive form of what we know as the CB1 and the CB2 receptor today. In fact, there was a really interesting study that was published not too long ago. I think it was actually maybe this year, where they've given a nematode who certainly has ortholog endocannabinoid system receptors, gave nematodes CBD for their whole lifespan. And what the researchers found is the nematodes that had CBD for their entire lifespan didn't have any major differences compared to the nematodes that didn't have CBD, but they lived on average about 2 days longer compared to their non-CBD exposed friends. And 2 days doesn't sound like a lot to us, but to a nematode that has a fairly short lifespan, unless it's like frozen or preserved somewhere and then can be reanimated, that's a long time for a little creature like that. Especially since some of these little creatures, I don't remember the lifespan of nematodes, but certain insects are only living a couple of days. So living 2 days longer is fairly long. The other interesting thing, since we've developed and evolved alongside these phytocannabinoids in particular, I get the question a lot, do we see allergies to these particular compounds? And the answer is by and large, probably not, but we don't 100% know yet. And the reason we don't 100% know is because we're still discovering some of these phytocannabinoids, and we're still actually parsing out or trying to find subjects that may have an allergy to these things that aren't described as an allergy to something else that is known to be allergic in a particular person or animal. So when it comes to phytocannabinoids, things like CBD, CBG, THC, any of the other hundreds of different phytocannabinoids, it doesn't look like there's going to be any allergies to those. However, it does look like there can be allergy to the other important topic and sets of molecules we're going to talk about today, and those are terpenes. It looks like there can be some allergies and certainly some sensitivity to them, dose dependent. Because we do use some of these terpenes or essential oils as like cleaning products and even pesticides, and we'll talk about that when we get there. So anyway, my point is, when it comes to phytocannabinoids, because we have evolved with these, it doesn't look like we have any sorts of allergies to them. And our endocannabinoid system has developed to have some sort of binding affinity with many of these phytocannabinoids. And what's cool about the binding affinity of these particular phytocannabinoids compared to other phytocannabinoids like THC is they all sit in these allosteric spaces on these endocannabinoid system receptors. And when we have drugs, whether it's a phytocannabinoid or a traditional pharmaceutical drug that sits on these allosteric binding sites, we mitigate some of the negative side effects. And the most potent negative side effects that we don't appreciate with full agonism at orthosteric binding sites are things like addiction, right? We used to believe that THC, or it was marketed heavily that THC wasn't addictive. THC is absolutely addictive because it does sit at that orthosteric binding site. It can downregulate normal endogenous cannabinoids like you see here on this particular slide. We can get some pretty exacerbated effects as far as inducing anxiety when we have THC at the orthosteric binding site, and then certainly some of the sedative effects and even hallucinogenic effects when we have full orthosteric binding sites activated by pretty much any molecule. So when you have the allosteric binding, we get mostly the good stuff with less of the bad stuff. So that's the cool thing about some of these other compounds outside of THC, and then certainly CBD as well. As this slide is presenting, it does say that these are the known endogenous cannabinoids. And the reason I have this up here is not necessarily to talk about those, but to really try to expand our mind past the THC and CBD conversation. So we have 5 known endocannabinoids to us right now. And a lot of researchers believe that there are several other endocannabinoids out there that we just haven't discovered yet. And I think this is why it's so important for us to start to study and certainly utilize things like these minor cannabinoids that might have a more similar structure, a more similar action to these other endocannabinoids that have their own physiological effects in whatever that is producing them. The other interesting thing to think about, we know this is well documented with THC and CBD, is we know that those particular compounds aren't necessarily married to just that CB1 and that CB2 receptor. We know that they can be fairly promiscuous and like to hang out with other receptors, which is totally fine because you essentially are getting a multimodal effect with one product, which I think is a great deal for us and certainly our patients. What we also know is some of these other minor cannabinoids also have some promiscuity for the different receptors. They are all not just sitting in either the orthosteric or allosteric binding sites of the CB1, CB2 receptor. We have a bunch of other receptors that these guys are talking to, which is really cool. But it's also another point to consider as far as expectations for particular profiles. And I'm going to keep hitting on this over and over, how important it is to look at these profiles and our expectations based on the cannabinoids and certainly the terpenes that we see in these products. Just to illustrate this a little bit, this graph, this is a little intimidating because it's showing all the different signaling pathways that THC and CBD, and it looks like a little bit of THCV in particular, have on different receptors and different systems throughout our body. And you can see it's fairly complex. And that's because the endocannabinoid system is involved in every physiological aspect of our being, of our animals' being, of our patients' being, right? So there is a lot of different crosstalk that we need to be mindful of. And again, just stressing the different profiles out there and what they might be useful for as far as a specific disease or condition that you're really targeting. I'd be remiss without discussing the care and feeding and certainly the endocannabinoid system tone. So these are two concepts that are really important when we start to consider actually dosing animals with these types of products. So when it comes to general endocannabinoid system health, and general endocannabinoid system health is really dependent on common factors that predict the health of other organ systems and other receptor systems. Our general physiology, and that is certainly diet, right? So in general, like eating clean, eating an anti-inflammatory diet, eating a diet that is clean and doesn't have a lot of different contaminants in it, either pesticides, fungicides, other nasty things that can make us sick is going to be critical. Certainly exercise is a really good way to keep your endocannabinoid system healthy. My endocannabinoid system must be extremely unhealthy because I absolutely hate exercising. But exercising can certainly increase our production of endogenous cannabinoids and certainly help regulate some of the hydrolyzing and catalyzing enzymes that take care of those endocannabinoids. Breathing patterns. We also know that if you practice different forms of yoga or you're doing these different breathing techniques, that can also help maintain and stabilize your endocannabinoid system. I wish we could explain that to our animal patients, but this is where I think things like acupuncture are actually helpful for that. If you notice an animal in acupuncture, whether I believe in acupuncture working for all kinds of different things it says it's working on, I do at least appreciate a change in the animal's presence with the person that's doing acupuncture, and certainly their respiratory rate starts to decline, they become more relaxed, which is actually a nice little pause and reset for your endocannabinoid system. Let alone, there's a couple of papers circulating out there with acupuncture stimulating the endocannabinoid system non-pharmacologically, either exogenously or endogenously, which is kind of cool. And then I mentioned a thing called the endocannabinoid system tone, and the endocannabinoid system tone is really dependent on how many endocannabinoid system receptors we have available that are open, that don't necessarily have an exogenous or an endogenous cannabinoid sitting at that receptor. It's also dependent on those other receptors that these compounds are working on at the same time. It is dependent on catalyzing or enzymes that are helping produce endocannabinoids, and certainly hydrolyzing enzymes. Those are the enzymes that are degrading those endocannabinoids. How many of these enzymes are being produced? Are we producing too much? Are we producing too little to where we have this inappropriate ratio of endocannabinoids to endocannabinoid system receptors, right? And then certainly the production of those endocannabinoids themselves. And one of the biggest conditions that has a hard time on the endocannabinoid system that can really deplete endocannabinoid system ligands from being produced is stress. So when people say stress is really bad for your health, stress is really bad for you in general, it's absolutely true because it is messing with your endocannabinoid system. And when we think about the endocannabinoid system being involved in every physiological aspect of our being, that's a pretty important thing to take care of. So important terms to be cognizant of, and certainly utilizing multi-faceted products, multi-cannabinoid and multi-terpenoid containing products is certainly going to help alleviate some of the stress. Very similar to, again, multimodal anesthesia or multimodal analgesia plans. Now, types of products. I'm sure you guys are probably aware of this, but I just want to go over it again. There are three main types of products on the market right now. We have isolate products, which are generally one molecule. Here in the US, we have Epidiolex, which is FDA approved. That is by and large a CBD isolate. So pretty much only CBD in there. We are starting to see other products out there, such as Delta 8 THC, isolate products. I've seen CBG products that are isolates. I have seen CBN, which is a compound that is often used for sleep, come in isolate products. So I think as we start to learn how to better manufacture and process these types of compounds, we will start to see more isolates, and then we can really become more of a tincture maker and add a little bit of this, a little bit of that, and make our own particular formulas, which I think is actually great because it's looking like a lot of diseases are going to need very specific profiles for specific things. Then we also have broad spectrum products. Broad spectrum products are typically products that have most of the phytocannabinoids and most of the terpenes and even flavonoids in them. These particular products can be a little bit tricky as far as marketing. So, technically a broad spectrum is any product that has more than just one particular phytocannabinoid in there. When I think of a broad spectrum, I often think that, oh, it's just the THC that was taken out, or, oh, I have some terpenes missing from extraction. But there are companies that are being disingenuous with you out there, and they're giving you like a 2-compound product. So maybe there is CBD with trace amounts of THC, but nothing else in there. That's not my idea of what I am expecting from a broad spectrum product, but it is technically still kosher to do and mention in marketing. So that's why I really try to lean on full or complete spectrum products. And those are typically products that have all the things a plant had to offer in there, all the phytocannabinoids, all the terpenes, and certainly all the flavonoids as well. There is some debate whether full spectrum products should also include the oil from the actual hemp seed or the hemp plant itself or the cannabis plant itself, because that oil itself is loaded with that plant's signature fatty acid profile. But I'm not there yet. And as long as it has all the phytocannabinoids, the terpenes, and the flavonoids, I'm still considering it a full spectrum product that I definitely like to lean on. Now, where does all this stuff get processed or made in the particular plant? So on the left-hand side of the screen here, we have a cannabis plant. You can see the leaves and you can see the flower on this particular plant. A lot of people seem to understand that these compounds are actually inside the leaf of these plants, or maybe they're inside the seed, but in reality, they're on the bud part of the plant. And you can see those little hairs. Those are called trichomes, and on those trichomes, it excretes this resin, and this resin is full of those terpenes and those cannabinoids and those flavonoids. So that's why when we say, when you're looking at a product, and if it says organically grown, like I might actually have a preference for that. I don't eat a lot of organic food in general. Nothing wrong with eating organic food, but when we think about this stuff and how it's grown and processed and where these things are being excreted, if it's producing a sticky resin on the outside of the plant, the last thing I want is pesticides or fungicides sprayed on that, because then it's very difficult to get it out of that resin. So for a nice clean product, I really like an organically produced product. And then if we were to look a little bit closer, this is a cross section of one of those flowery parts of the flower on the cannabis plant. And you can see the little trichomes here coming off the base of the plant. You can really see this really is a happy plant because we have all these other little vesicles where these things are being produced and then excreted through the trichomes. And what's kind of interesting is there are manufacturers now that are using different technologies to colorize these different compounds coming out of the plants. And based on the colors or the amount of colors they can see, so if you look at the picture here on the right-hand side of the screen, and let's call the little red dots, let's call them myrcene. Myrcene is one of the terpenes we're going to talk about today. So by looking at the colored dots, they can assess, oh, wow, this product's going to be high in myrcene compared to all the little purple dots, which are, let's say, caryophyllene, another terpene. So there is some really interesting technology that is being produced out there to look even plant side at what kind of profiles these plants might be producing for us. Now with that, I did want to show you some of the more common phytocannabinoids that we have available to us. Like I said, there's over 100 out there and more being discovered all the time. These are the ones that you're probably going to see most often. So we have CBGA, we have CBD A, and we have THCV, CBN, CBC, delta 8 THC, and CBDV. I'm not going to spend a lot of time on these different phytocannabinoids only because we just don't have the same kind of evidence that we have for THC and CBD specifically. There's a lot of interest and a lot of research going into it, but we just don't have the same type of data out there to really speak for a long period of time on this. And we certainly don't have dosing or pharmacokinetic data in our small animals for these particular compounds. We do have a bunch of really good studies. These are actually two of my favorite PK studies out there. They're actually from Canopy up in Canada. I think they did a really good job with these dose escalating PK studies in cats and dogs. And then more recently in their cat study, which complements a dog study that I was part of, they started looking at the metabolites produced from these different compounds. And what we're also finding that these studies kind of elucidated was that some of these minor phytocannabinoids or the acidic forms are actually absorbed as well, if not better, compared to the decarboxylated or more common forms of THC and CBD that we see in a lot of different products. What's also kind of interesting is it does appear that even these acidic forms, which I'm going to explain in a little bit, are not only absorbed better, but have different properties as well. So when we talk about the different phytocannabinoids and where they're coming from, we have this one particular phytocannabinoid that is considered like the mother molecule that the plant produces, and that is CBGA. It is formed from a couple of other compounds that the plant produces before it, but CBGA is really our first phytocannabinoid that our plant is going to be producing for us. And through either the nutrient content the plant is receiving, oxidation, light, heat, all the different things in the environment, we will have a different expression, or we will have a change of that acidic form, molecularly speaking, into different, more commonly known phytocannabinoids. So CBGA will turn into decarboxylated CBG. It will turn into THCA, which is the precursor to regular THC that you're familiar with. It turns into CBDA, the acidic form of CBD and one of my favorite phytocannabinoids. Then we have CBCA and so on and so forth. So this is really our mother compound before it turns into all these other phytocannabinoids. And there's a lot of interest in doing early harvest of cannabis plants to get high levels of CBGA, because then you can then turn that CBGA into pretty much anything that you want, either through acid, heat, oxidation, or other processing. So it is a really valuable compound. And I've heard a couple of medical cannabis enthusiast with relatively good credibility. I'm not going to say I fully support this, but I think it is an interesting mention of using CBGA in lieu of THC or CBD, because allegedly, I'm not holding on to this tight. Allegedly, CBGA might be able to bioconvert into whatever your endocannabinoid system needs. I think that's a little bit miracle worker sounding, but it is an interesting concept, and maybe in the data it'll be proven soon. So anyway, that's our mother molecule that we really, really like, can turn into any of the other fun things. As I mentioned, in the US, we do have one FDA-approved CBD isolate product, and it's, interestingly enough, derived from what we consider marijuana here in the States, greater than 0.3% THC containing cannabis sativa plants. So really interesting, but unfortunately, it's an isolate. And the isolates are really lacking a lot of the other cool things that we can see that benefits from a multidimensional kind of product. Multi-compound, multidimensional, I think is the right phrasing for that. Anyway, this is a little chart, kind of amalgamation of all the different studies out there that we have available, showing some evidence, whether it's in a petri dish or a living animal, looking at the therapeutic potential benefits of each individual phytocannabinoid. I have a question from Sue Sanders, and it is, how closely related in terms of the phytocannabinoid profile are cannabis and cat? That's a great question. Cats seem to be very good at self-medicating. Yes. So I am forgetting the name of the terpene that catnip is. I think it starts with a G, like, oh, I'm forgetting it off the top of my head. They're very, very similar. In fact, we can produce the same terpene. Nope, not that one, Sarah. We can produce the same terpene that is in catnip from some of our other terpenes that I'll actually talk about. But very, very close, and you're absolutely right, Sue Sanders. Unfortunately, our cats are pretty picky with some of the terpenes that they like and dislike as well. Okay, so I was going to talk to you about one of my favorite minor cannabinoids, and that is CBDA. That's the acidic form. I like all of the acidic forms, really, but CBDA I think is particularly cool to me, just because of some of its really interesting preclinical work as far as anti-inflammatory effects and certainly cancer effects, and certainly its effects on the entourage effect and absorption of these compounds. So when we as practitioners in general think of like the anti-inflammatory effects when we hear cannabis in general, I think a lot of us go down the pathway of how non-steroidal anti-inflammatory works. CBD and THC don't work that way. And these are actually two studies showing that they do not work that way. They are not COX inhibiting like our non-steroidal anti-inflammatories, but our acidic forms, whether it's CBDA, THCA, or CBGA, are pretty potent COX inhibitors. In this particular study on the left, you see the animals had about a 30% inhibition of COX inhibition with the acidic forms, whereas the decarboxylated forms of THC and CBD certainly were not showing that COX inhibition. There was also a recent horse paper that was published this year. I'm not sure if it's out in its final form yet, but they were also looking at COX inhibition of CBD and didn't find anything. And I wanted to reach out to the author and say, why don't you test some of the acids? I bet you'll get a different effect there. So when we're talking about the anti-inflammatory properties, the acidic forms are working more similarly to non-steroidal anti-inflammatories. With that said, and I know this question always comes up, that does not necessarily make me pause and not give non-steroidal anti-inflammatories at the same time. For whatever reason, still to be determined, it's looking like these phytocannabinoids also have a GI protective effect at the same time, and just general protective effects in general in several organ systems that are not having as much, or not causing as much concern with like PGE2 specific inhibition and the health of the GI and certainly kidneys and whatnot. Oh, there it is, Sarah. Yes. Oh, and Kathy, look at, I have the two greats with me today. So nepelectone is the terpene in our catnip. And I will tell you that I had actually developed a product with nepelectone in it, and the cats were pressing their face into the product. So it seemed to work, just never took it to market. Anyway, so yes, our acidic forms do have COX inhibiting effects, whereas our decarboxylated forms do not. This is a particularly interesting study where they were actually comparing the acidic form of THC to common anti-inflammatories. And you can see that the therapeutic index, they weren't testing efficacy, but they were testing the safety of these products. The therapeutic index for the acidic form is significantly higher compared to our non-steroidal anti-inflammatories. I think we're all familiar with NSAID toxicity and how easily that can happen. That's not something that we appreciate with these acidic forms of these cannabinoids. And just for clarification, CBD THCA, the acidic forms are non-intoxicating like the decarboxylating form or the decarboxylated forms. So you're not going to get high from consuming THCA. Now, when it comes to some of the studies as far as the utility of some of these acidic forms, not only do we have this pretty potent anti-inflammatory effects or COX inhibiting anti-inflammatory effects, but we also have some good studies out there, at least worth sharing, I felt today, with CBDA in particular and THC for nausea in rats. And this study was confirming that CBDA plus THC was really, really good at preventing this kind of gaping response in these rodent animals. And anecdotally, we have a lot of good reports, at least from people that are receiving chemotherapy, who are really benefiting from the acidic forms for their chemotherapy-induced nausea, which I think can be appreciated in our animal friends as well. As far as dosing with these different products, this is another reason I really try to use full or really robust broad spectrum products, is it looks like when we use an isolate product, certainly of CBD, I'm curious to see if like we were to do this with CBG, if we would have the same effect, but it looks like we might have some interesting dose responses and some less linear responses to like doses of an isolate compared to a full spectrum product. And I think that's really because we're hitting several different targets with these full and broad spectrum products. So basically what I'm trying to say, when we use a broad or a full spectrum product, we can generally lower the dose compared to an isolate product that we might be using in an animal instead. And that leads me to the entourage effect. So the entourage effect is this idea that all of these compounds together in a broad and a full spectrum product are going to potentiate each other and create this synergy and make a better effect for the animal. And just like in our multimodal anesthesia and analgesia protocols where we use multiple things, we can lower the overall dosages and mitigate some of the negative side effects that we might see with higher dosages of individual compounds. And that is certainly true when it comes to cannabis products. The best example of that is THC, right? I think we were all taught that, oh, THC is toxic and it's going to get animals high, blah, blah, blah. We know that a little bit of THC is not a bad thing all the time. And certainly when we have it in combination with other phytocannabinoids and certainly terpenes and flavonoids, we do get a better overall effect. And there is even some evidence out there showing that CBD can actually dampen the negative side effects that we see with THC. And I'm curious to see how many other phytocannabinoids are actually having this negative allosteric effect on THC toxicity. So really interesting stuff to consider. But the entourage effect is really, really important for understanding the utility of these multi-compound products. Outside of compounds that we get from plants, like terpenes and other phytocannabinoids, your body is also producing some endocannabinoid-like molecules, in particular PEA and OEA. I'm not even going to try to say those long names right now, but these are endogenous cannabinoid-like compounds that your body is creating. And they do work and create a natural entourage effect with endocannabinoids in the system. We have a really great paper in dogs specifically looking at PEA levels with endocannabinoid levels in the synovial fluid of dogs with arthritis, and showing that the entourage effect isn't just this woo-woo thing that all these cannabis people are talking about. This is a naturally occurring process within our own physiology as well. Now, when it comes to the entourage effect and terpenes specifically, as we start to get into this discussion about terpenes, there's some conflicting information. So one of my heroes is Dr. Ethan Russo, and he put out this great paper, Taming THC, Potential Cannabis Synergy and Phytocannabinoid Terpenoid Entourage Effects. And I don't think in this paper he ever really said that terpenes are causing this entourage effect or like specifically producing this type of effect. But I think what he is suggesting in this paper is the other therapeutic benefits in combination with the entourage effect with phytocannabinoids can certainly make the overall outcome of administering or dosing animals and certainly people with these products better. In fact, there was a study that was published in early 2020, last year, where the authors were looking at common terpenes that are found in hemp and cannabis in general, and looking at their binding affinity to the CB1 and the CB2 receptor. And what they found is they didn't really bind to the CB1 and CB2 receptor. So in this study, they were saying that terpenes are not producing the entourage effect, which in my opinion, I think this paper was just maybe organized and maybe written by people that are less familiar with real cannabis science, because that's not kind of the point of the entourage effect that we're talking about by and large. Illustrations of the entourage effect in literature that we have available to us today. This paper was from a buddy of mine, Dr. Joe Washlag, and his colleagues. And they were actually doing some IC50 tests for different cancer cell lines, memory carcinoma, canine lymphoma, and canine osteosarcoma, two different forms. And what they did in this IC50 test is they have a petri dish of these different cancer cell lines, and then they gave these cancer cell lines a bath of individual isolates. So a bath of CBDA, and they found, the CBDA wasn't very good at killing these different cancer cell lines. And then they mixed it with decarboxylated CBD, and they found, wow, decarboxylated CBD does a pretty good job at killing these cancer cells. In fact, it's very similar to what we would see with doxorubicin. And then they mixed the things together, the CBDA, the CBD, and some of the terpenes, and they found, holy cow, this is killing as good, if not better, than traditional drugs like doxorubicin. And we don't necessarily have to be worried about the cardiotoxic effects of doxorubicin. The limiting factor with these particular studies, unfortunately, is the dosing that you would need. You know, chemotherapy is like $600, $700, $800 an injection, depending where you go, at least here in the States. And when we're talking about the necessary doses to get this anti-neoplastic effect in circulation with these animals, we're looking at pretty high dosages, certainly greater than 5 milligrams per kilogram. But again, that's going to be dependent on the endocannabinoid system tone. So by and large, we're going to need pretty large dosages for anti-neoplastic effects versus dosages that we would need to treat symptoms related to cancer therapy or symptoms that the cancer itself is producing in those patients. Another really nice illustration of this was from Dr. Miri's lab in Israel. He's one of my favorite cannabis researchers, right behind Dr. Ethan Russo. And what he found, and I think this is so important, especially because people want to use cannabinoids as a panacea for many different things, is he is finding that with every different type of cancer, we're probably going to need a very specific ratio of cannabinoids to terpenoids for that specific type of cancer. It's not going to be, one size fits all. We can't shotgun every cancer with a particular profile. In fact, there's even some studies showing that THC, which I don't have a problem with, can actually be proliferative for some types of cancers, in particular squamous cell, oral squamous cell carcinoma in people can actually enhance that particular type of cancer. So I want us to be very careful with THC in particular in cancer unless we have evidence showing that THC is not going to be proliferative for that type of cancer. And then we also have to be mindful, again, that we might have to find different products that are going to be specific to the type of cancer that we are treating. Anecdotally, I will say that it does appear that the acids seem to work really well for osteosarcoma and certainly metid cancers to the chest. Even with non-specific diagnosis of that type of cancer, those metid masses seem to be very responsive to acidic forms of cannabis, which is exciting. Another illustration of the importance of looking at these profiles and how these different profiles can have an effect on an animal or a person is this study where they were assessing the anxiolytic effects of two different products. And you can see the products on the little graph on A and B on the left-hand side of the screen are not too different. I mean, the bottom product does have a lot more CBD in it compared to the top product, but they are pretty similar. Where we see less similarity is with their terpene profile. You can see that the trans-neurylidol, there's also a cis-neurylidol, which I thought was kind of interesting. The trans-neurylidol is really high in product A, and is like the third most common terpene in product B. And the product A actually failed in reducing anxiety in the people that were taking this particular product. And I honestly can look at this profile, once you get comfortable reading terpenes, understanding their therapeutic effects, and certainly the cannabinoids as well, you're going to be able to look at these certificates of analysis and say, that product's probably not going to work for that particular animal or that particular condition. And I know this because neurylidol is a terpene that we often see in citrus fruits. And when we think about citrus fruits in general and the other terpenes that they're with, like limonene, we know that those particular terpenes can be more uplifting and can be more, can upregulate things instead of downregulate things, where the second product, myrcene, myrcene is a pretty powerful sedative or pain relieving terpene as well, which we'll talk about in a second. So it is important if you're not having success for a particular condition with a particular profile to try other profiles, because there are going to be nuances in these ratios for certain diseases. Kind of a fun little study that they were doing, these poor rats. Mice. All these poor mice and rats are always subject to some really interesting studies, but it's critical for us to help understand these things. So I completely respect and appreciate their contributions. This particular study was looking at the central effects of citrol, which is another terpene that we're not really talking about today, myrcene and limonene, from a particular plant in understanding and getting through a maze. And what they found is, just like with a lot of other drugs that we are using, the clinical effects are really dose dependent, certainly with memory formation and certainly muscle movement in these particular animals. And what they found is by increasing the dose, we started messing with these animals more, which I think is something important for us to remember when we're starting to assess the terpene concentrations in these particular products. So let's talk about terpenes specifically now. So when we look at a certificate of analysis, hopefully we'll have a nice little breakdown like this, where we can see the phytocannabinoid concentrations, hopefully to be in mg per mil, so it makes it easier for dosing and understanding. And then we should also hopefully have like a terpene profile. This is a really, really robust and really concentrated terpene profile. Typically, when I am looking at terpene profiles, in a particular product, I like to see, do you see this bottom percent where it says 1.36%? I typically like to see that at least 0.1% or higher. There has been a little bit of research looking at what dose is really necessary to get therapeutic effects from terpenes, aka essential oils. And it appears to be at concentrations 0.05% or higher. With that said, we also need to understand the metabolism of these terpenes as well, right? So terpenes are the smelly component to these plants. And when you smell things, those terpenes are being metabolized by your olfactory cells. And something that I learned, and probably Dr. Kramer as well, in reviewing the book that we have coming out, is our body has these olfactory cells all throughout its system. They aren't just in the nose, they aren't just in the mouth area, they're all over our body. And whenever we smell these terpenes, we can expect pickup from the microcapillaries in our mucous membranes and our nasal cavities, and certainly these olfactory cells, and we can measure these terpenes throughout our bodies systemically. We can also measure within seconds metabolites being produced from these olfactory cells when they come into contact with some of these terpenes or these essential oils, which I think is just amazing that we have olfactory cells throughout our body, not just in the face, like I think we all kind of presumed, and they metabolize things really, really quickly within seconds, which I think is pretty cool. All right, I'm just gonna check this chat. So the question was, people would like to see the chart and whatnot. I am happy to give you all of my slides. So at the end of this lecture, what I can do is I will put my slides on my website, which is just my name, stevensital.com, and you guys can download them there. And then obviously you can email me through my website as well if you want any specific papers. All right. So before we go further, I also wanted to just remind everyone, I think Canada is in a little bit different situation compared to where we're at in the United States. You guys do have some testing here in the United States, unless a product is being sold out of a specific state that is demanding testing. A lot of these products are not tested by a third party and can have some pretty unfortunate contaminants in them. This particular study that I was part of, we pulled multiple products that were labeled for veterinary patients and found that there were some concerning contaminants in there, in particular lead and arsenic. One product had so much lead in it, it was considered unsafe to consume per the United States USP on allowable contaminants and consumption. So there are points of concern that I still have. I think a lot of supplements actually have these same problems, especially with the active compound that you were trying to purchase actually being in there, because we certainly found CBD products that had no CBD in them at all, or any phytocannabinoids for that matter, but had high levels of terpenes in them. So it smelled like a cannabis product, but actually didn't have the phytocannabinoids in there at all. I have another question from Julie Shaw. I know Julie Shaw. Can homegrown growers get COAs on their grows? Absolutely. So there are a ton of different third-party labs now where you can submit some of your flower or your product that you're making to a third-party company, and they vary in price and they vary in quality. I think if you're first getting started with testing your own products, it is important to test the same product at a couple of different labs and notice any discrepancies in them. Maybe 2 to 3 different labs would be good. The third lab, I would cut out the lab that was least similar to the other 2 that you got. And then the pricing is certainly all over the place as well. I've heard of full profiles. I like full cannabinoids, full terpenes, flavonoids if they have it, elemental analysis, mycotoxin, and bacterial pathogenic analysis. That can cost anywhere between a couple of $100 to like $1,500, depending on the lab that you go to. In the United States, it is recommended that these manufacturers go through an ISO/IEC 17025 certified lab. That means someone is checking up on that lab to make sure their practices are using appropriate scientific methods. All right. So the other kind of cool thing about terpenes, at least here in the United States, is they are considered grass, no pun intended, I guess, but grass is generally referred to as safe, and terpenes are allowed to be added to food products here in the United States. They are also allowed to be added to cosmetic products, so any lotions and stuff like that. So that's why when you have those lemony smelling or citronella smelling candles and lotions and whatnot, those are all terpenes that are added to those particular products. We also know that flavonoids can be used and manufactured synthetically and added as flavor enhancers for food as well. Interestingly enough, because in some places or just out of innovation, people are hesitant to use phytocannabinoids, so things like CBD, THC, and all the other awesome phytocannabinoids out there. There are companies out there making terpene profiles that are similar to particular varieties of cannabis plants with particular ratios of terpenes compared to other terpenes for therapeutic benefit. One company in particular called True Terps will match a terpene profile to something else that is already on the market, sans the phytocannabinoids. With that said, at the last Canadian cannabinoid group meeting that we had in person in BC, I thought Dr. Ethan Russo mentioned something that was really valuable, in that there is some concern with some of these synthetically produced terpenes and certainly the cannabinoids. But with the synthetically produced terpenes, we should also ask for some sort of manufacturing standard for contaminants in those synthetic products as well. Let's see. Carrie asks, when terpenes are added to products for fragrance only, do they still maintain their pharmaceutical properties? And the answer is yes. You may not have enough in there to create a noticeable feeling, but I think a nice example would be some of those lavender shampoos or those lavender lotions and whatnot, right? So lavender, you know what? I'm going to save that. I'm going to get ahead of myself. The answer is yes, and you'll see why in a second. All right, so let's talk about some of the common terpenes. You guys, there are hundreds of different terpenes, so I'm going to talk about the ones that are most common in a lot of cannabis plants that we are purchasing or cannabis products that we're purchasing. So limonene in particular. Limonene, all of these terpenes, you guys, are not only found in cannabis, they are found throughout like nature in general. Any fruits and vegetables that you've eaten, you've probably had phytocannabinoids and terpenes before. Flowers are producing these things. All the plants are producing these things in some way, shape, or form, just at different concentrations. So limonene is one that we see heavy in citrus fruit. It is certainly that lemony smell, right? Some people pronounce this limonene. I don't really know how to say it. You know, we say lemon, so I'm not going to say limon from now on. And same with, I'm sorry, I'm going on this tangent. People often say cannabinoids, and I say cannabinoids. And I don't know if there's a right or wrong way to say it, but we say cannabis. We don't say cannabis. So anyway, that's my tangent. With limonene in particular, we have some interesting studies. And one of the cool things that limonene can do for us at appropriate concentrations is actually be an immune stimulant. So it can provoke an immune response, can better an immune response for us, which I think is kind of interesting. We also know that even though limonene is an uplifting terpene, it is also anxiolytic as well. So it'll wake you up and hopefully decrease some of your stress levels with being more woken up. I know a lot of the anxiolytic drugs and things that we are used to taking for anxiety are more sedative. This one is uplifting and anxiolytic, which is kind of cool. And I wish we had more drugs like that. Limonene has also been found to be useful for its anti-proliferative effects for certain types of cancers, in particular breast cancer. A lot of these terpenes have been evaluated for breast cancer, and a lot of them, I think all of them actually, were effective in decreasing proliferation of certain breast cancer cell lines and cancer in general. With that said, I think we need to be careful when we say something has anti-cancer effects. A lot of things in a Petri dish have anti-cancer effects. I was talking to an oncologist when we were talking about terpenes and their anti-cancer effects. And she had done a study in her residency with loperamide. What is the trade name of loperamide? I can't remember. But loperamide, we know, is an anti-diarrheal drug, right? So loperamide can actually kill cancer cells in a petri dish, but unfortunately, the dose you need it at, you would never probably have a bowel movement again, or your patient would never have a bowel movement again. So just because something can kill cancer in a petri dish, we have to be careful with like making these promises for clinical use and in a clinical setting as well. So limonene is also a really good antibacterial terpene, and we actually do use limonene in cleaning products as well. When we get concentrations of limonene greater than 20%, limonene is considered an industrial cleaner. So we also have to be careful with it at the same time. Too high of concentrations can actually be damaging. Limonene in particular is also used for skin permeation for different pharmaceutical drugs. In particular, they'll use it in larger animals to get drugs into the dermis layer for pickup. But those higher concentrations that we might use in a large animal might actually burn the skin of our smaller animal patients. So we have to be a little bit careful there. Limonene in a little bit higher concentration is also really good for like skin parasites. So if you have things like scabies or Demodex, there are creams that are higher concentrations of limonene that can be helpful for those little skin parasite friends. Then we have pinene. So pinene is one of those other amazing terpenes I really like. We do have evidence suggesting that it is a relatively good bronchodilator. And certainly we know it as a cleaner as well. If you've ever used pine sol, that is super concentrated pinene, alpha pinene, that can be used as a cleaning solution as well. And then the other really interesting thing about pinene, and this is total postulation. So like when you go to a forest and you take a nice deep breath, like you take another nice deep breath and your lungs just feel so much more clean, so much more open, right? So that's maybe the bronchodilator effects that we're getting from pinene. But pinene, when we go camping, we always clear our heads and we have nice memories of camping. Pinene is also really good at helping memory enhancement. So maybe we have better memories of our camping trips because pinene is working on our memory system and enhancing, producing these better quality memories or relaxation. We also know, like many of the terpenes, this can be anti-inflammatory as well. Myrcene, one of my favorite terpenes out there. We see high levels of this in hops and in mangoes. So often when people are saying, oh my gosh, if you eat a mango before you smoke some cannabis, you'll get more high. You don't necessarily get more high, you get more sedate and maybe get some couch lock. But myrcene has some really, really interesting therapeutic advantages by itself. This particular terpene can be reversed with naloxone and yohimbine. So if it can be reversed, its effects with naloxone, we know that there's probably some affinity at our opioid receptors. And then if it's being reversed with yohimbine, we know that it probably has some effects at the alpha receptors as well. And both of those receptors are really important for pain management. Some of the other benefits of myrcene in particular is it does seem to decrease the formation of PGE2, which is kind of our more irritating inflammatory marker that Galliprant in particular is trying to block. And then we also know that it can cause some mild sedation and muscle relaxation, and is also good at preventing cancer in the liver from alpha toxins, which are some naturally occurring fungi that can grow on foods, which is kind of interesting. So products or plants that produce high level of myrcene are probably not going to have any scary forms of mycotoxin or alpha toxins in them. Linalool. So linalool is, again, one of those anxiolytic terpenes that we can purchase in several different forms, whether it's lotions or candles or lavender flavored things in general. This is kind of cool because the odor alone of linalool is anxiolytic in several different animal models, which I think is really interesting. But on the other side of that, we also know that high concentrations of linalool can be dangerous. It's actually used as a organic pesticide. And in fact, that soda manufacturer LaCroix got sued for claiming to be organic, but some of the hippy dippies found out that they're using high concentrations of linalool as a pesticide, and then we're suing them saying it wasn't organic because they're using an organic pesticide. Anyway, high concentrations can be a little bit dangerous, but in general, linalool is a good anxiolytic drug. It's also really good for local anesthesia, especially rubbed topically. Beta-caryophyllene. So this is one of our most common terpenes that we see in the cannabis plants. This is also a very common terpene that a lot of companies are spiking into their CBD product, because beta-caryophyllene can act very similarly to some of our other minor cannabinoids and is really cheap. We often see beta-caryophyllene being extracted from black pepper, but several other plants have this as well. Beta-caryophyllene is also really nice at helping cleaning out the liver, especially in conjunction with piperine combined. I'm almost out of time, I'm sorry. Neurilidol is one of those other cool terpenes that is being researched more extensively now than I think before. So neurilidol not only is having some really interesting kind of sedative effects and anti-cancer effects like a lot of the other terpenes. It's also really good skin permeator terpene to drive down other drugs into the dermal microcapillaries. But it is also being looked at for enhancing the effects of antibiotics and making those nasty little bugs in our circulation more sensitive to antibiotics. So there is work being done looking at neurilidol for enhancing the efficacy of some antibiotics, which I think is really cool, because we're kind of killing two birds with one stone, where maybe having the therapeutic effects of neurilidol for our patient that's receiving it, but also hopefully minimizing some of the concern about antibiotic resistance by making these bugs more susceptible to the antibiotics. Then we have humulene. Humulene is one of those interesting terpenes that we also find high concentrations of in hops in particular. I like this particular terpene because it does have some interesting effects as far as its effects on, oh my gosh, appetite. That's what I'm trying to say. So humulene not only has these anti-cancer effects, these anti-inflammatory effects, like so many of the other terpenes, but one thing that really stands out with humulene is its efficacy for decreasing appetite stimulation, which is kind of nice. And when we start thinking about those studies that have come out with Delta-9 THC in particular actually being useful for weight loss despite getting the munchies, I think humulene might have something to do with some of this research, and certainly other strains that may suppress appetite. Now, borneol is, again, one of our few terpenes that we're wrapping up with. Really interesting stuff as far as oxidative stress. I think this is going to be really the champions that we're going to find in anti-cancer products out there going forward. But again, a lot more research needs to be done with this particular terpene. And then we have geranol, which is also a very exciting drug as far as its effects for antipsychotic properties. It's also a nice catalyst for creating another terpene called terpenol. And terpenol is one of those terpenes that can really be turned into several different things, that has kind of like the shotgun effect as far as its anti-inflammatory effects, anti-cancer effects, anti-whatever effects you're looking for. Terpenol are a group of these terpenes that can be derived from geranol in particular. We know that this is a heavy terpene found in bay leaves in particular. Now with that, something that we are still not understanding completely is if these terpenes are in fact messing with the cytochrome P450 enzymes at all. I would think that the concentrations that we're giving our patients are not necessarily doing that, especially since we have such quick metabolism by the olfactory cells or receptors in particular. But I did want to mention for the phytocannabinoids, this is something you guys we need to be very careful with our other minor cannabinoids. We know that each particular phytocannabinoid may be inducing or inhibiting specific cytochrome P450 enzymes, and we just don't have the data right now for a lot of these other minor ones. At the concentrations we're using them at right now, I'm not really concerned, but when you start to see this particular minor cannabinoid isolates and you want to do heavy dosing with those, I would just stress caution and be mindful of drugs that can be negatively impacted by cytochrome P450 changes. With that, I believe I'm done. And a couple of resources, as I mentioned, we do have a book coming out. Dr. Kramer, Dr. Silcox, Dr. Mosley are all authors in this. We expect this out in the next month or two. And then certainly if you're on Facebook, we have the Veterinary Cannabinoid Academy. If you want to follow that, we post a new study every Friday. And then certainly if you have any questions or want my slides, there's my website. Thank you so much, everybody.